This video is about Wilson's disease. Wilson's disease is an autosomal recessive disorder, which is characterized by the ineffective excretion of copper through the liver duct. It occurs in about 1 in 30,000 individuals. In this picture, we can see on the left a normal hepatocyte, which is a liver cell. And we know that this is normal because this person has ATPase2, which is a protein that moves copper out of the liver. The way that we have ATPase2 is if we have a gene called ATP7B. So on the right, a person with Wilson's disease does not have the gene ATP7B, or it's been mutated, and therefore they're not able to code for that protein ATPase2. So although the copper is moved into the liver, it's not moved out, and it builds up and causes hepatotoxicity, or toxicity in the liver. Here we can see that, again, copper is moved into the liver, but not moved out of the liver. So without ATP7B, copper builds up in the liver and in the bile duct and in the cytosol of cells. Here we can see a hepatocyte where copper is building up in the cytosol. Toxic accumulation of copper occurs not only in the liver, but also in the kidneys, the cornea, and the central nervous system. When copper builds up in the cornea, it produces something on the surface of the eye called a Kaiser-Fleischer ring. It doesn't cause visual impairments, and it's usually a late manifestation of the disease, meaning that copper would first build up in the liver and then on the cornea. Why would someone with Wilson's disease have neurological symptoms? Because the copper builds up in sensitive cells. Oligodendrocytes, which myelinate the central nervous system, are very sensitive to copper. And when copper builds up on these oligodendrocytes, it can cause basal ganglia damage. Usually, neurological manifestations of the disease occur much later in disease progression. However, if a person doesn't first exhibit signs of liver damage, for instance, elevated liver enzymes, then their first visible symptom might be something like a movement disorder or a behavioral disorder. This is a graphic to help you understand how copper builds up in the liver and can cause hepatitis and cirrhosis and even liver failure, and how it can affect the basal ganglia. When we have basal ganglia injury, we have things like incoordination and tremors, and we also can have things like behavioral changes. Some people have described an adult with Wilson's disease having temper tantrums and crying bouts. So you can see how that would be concerning to someone's family. Who can inherit Wilson's disease? In order to inherit an autosomal recessive disorder, you have to have two parents who are carriers of the defective gene. Now, if you have two parents with the defective genes, you might be 1 in 4 who would be affected by that disorder. So you have to inherit 2 mutated genes. In order to diagnose Wilson's disease, we can use blood and urine tests to check the level of either copper binding proteins like ATPase2, or we can check the level of copper in the blood. A slit lamp can be used to diagnose KF rings in the eyes, and you can see here a picture where a slit lamp is used to really see that Kaiser-Fleischer ring. We can also use a liver biopsy, like we saw in the slides like we saw in the image a few slides back. We can see that copper building up in the cytosol of the cell. And lastly, genetic testing can be done to identify mutations. Here you see a karyotype with chromosome 13 highlighted. Chromosome 13 has 113 million base pairs. So I've also highlighted where Wilson's disease is one of the manifestations of a chromosome 13 disorder. Treatment for Wilson's disease involves something called chelation therapy. A chelator is a compound that can bind with a particular ion, such as copper, and transport it to be excreted. The drawback with these chelators is that they can bind not only to copper, but also to other metals such as iron. And then we can end up with something like an iron deficiency. So we can also use zinc salts, which prevent the absorption of copper by tissues and cells. Prognosis for someone with Wilson's disease really depends on the time when we catch it. For people whose first symptom tends to be a neurological symptom, that disease is already so progressed that prognosis is not excellent for quality of life. However, we can usually stop the progression of the disease by using those chelation therapies. For someone whose first symptom is something like elevated liver enzymes, we can often clear that copper and then make up for the loss of that protein with chelation therapy, and they live a long, happy life. However, they would need to avoid all hepatotoxic substances like alcohol, medications, and copper-rich foods. Chronic liver disease can also lead to carcinoma of the liver. And so you can see that this disease has a large risk of fatality if we don't get treatment in a timely manner. In this picture, you can see a professor of biochemistry at the University of Missouri who was awarded 2 grants at almost $4.5 million to study the role of copper in cancer therapy and Wilson's disease. So he's experimenting with a compound called DPM 1001, which reduces copper levels in cells from patients with Wilson's disease. The unique thing about this treatment is that it doesn't affect other levels of other metals. And so we wouldn't end up with something like an iron deficiency with this treatment. Thank you so much for watching.